it acceptable or unacceptable for a Prime Minister to have it? 53% said it was totally or slightly acceptable.
Yes, I think this might surprise some people in number 10. Obviously, they felt a great deal of media pressure over this question since it was asked directly to the Prime Minister on Sunday. It then sort of percolated, bubbled up. You heard people sort of questioning, and I think particularly the Prime Minister's refusal to answer the question was the big political issue there. He looked shifty, unlike in 1987, where Margaret Thatcher was asked this question and said, yes, I have private health insurance. I don't rely on the NHS. I'm the Prime Minister. You know, she was very forthright in that. Rishi Sunak was taking the line that this was a private matter. He shouldn't be saying whether or not he has it. And then, of course, we fast forward to Wednesday at Prime Minister's Questions. The first question that he was asked, he decides to say that he is not registered with a private GP, although he had been in the past. Number 10 are not saying at what point he unregistered or got rid of his private health insurance. That is open to interpretation. But it is fascinating to see 53% of the public think it's acceptable for the Prime Minister to have private health insurance. Only 27% think it's unacceptable. Now, this looks like a totally winnable argument for the Prime Minister. Had he stuck to his guns, it's very easy to see how he could have made the case that he's a very wealthy man, that he doesn't want to be taking up a spot that could better go to some people who aren't of as much means, and it's clear that there could be a strong argument that people who are very wealthy, perhaps it's a good thing for them to have private health insurance. Perhaps that helps the country overall, puts more investment into our healthcare system overall. It's an argument that the Prime Minister could have made, I think, looking at these numbers, but chose not to.
Yeah.
Why did he choose not to? Is it in part, do you think, an argument saying you're out of touch, you don't know about the NHS, you don't know about waiting on an ambulance or waiting on a doctor's appointment? Or could it be, he speaks so proudly about the NHS and his family background, did he not want to be seen to be turning his back on his roots?
Yes, he's spoken very, very often about coming from an NHS family, his dad being a GP, his mother owning a pharmacist, and clearly healthcare is in his roots. But I think the most acute thing is obviously the fact that opposition politicians, and indeed many in the media, have been saying that really, do you know what it's like? Do you understand what it's like to wait for hours upon hours, perhaps half a day for an ambulance? Do you understand what it's like to be sitting on the phone trying to get that GP appointment? And ultimately, it's a powerful emotional argument, even though in reality we look to how sort of other countries around the world handle these things. I mean, the President of the United States isn't queuing to go to hospital. He's got a private physician in the White House. The President of France has, I think, 4 private physicians in the Élysée Palace. To some extent, Prime Ministers don't experience life in the same way that you or I do. And I wonder if we need to have a more rational conversation about what we should expect our leaders to be doing and what is the best use of their time.